Hello, everybody. So, roughly 25-day post-op update. I had a 2-level artificial disc replacement, L4 to S1. I had 2 ruptured discs, predominantly from, of course, I had a pretty extensive athletic, competitive athlete background, a lot of fitness training. So I imagine there was probably some wear and tear in that discs over time, but I never really had issues. And then I got T-boned by a van that was going 70 miles per hour, 2017, and I believe that's when those discs truly ruptured. After that, they very rapidly thinned out, and L5 S1 was almost bone on bone at that point. And through that time, although not acute, but pretty aggressively over time, those discs became asymptomatic from about 2018 or 19 till about 2022. That's when I started to look into, got the neck fixed, had a 2-level ADR there, and then in 2023, after I recovered, started pretty aggressively looking into my intervention options for those 2 levels in my back. So went with Rasouli in California. I just thought he had a really good history with the athletic or physically active population. Talked to a lot of people who returned 100% to where they were previously before they had bad back symptoms, etc. So anyway, 3 weeks. At week 3, I was kind of in limbo because I had my x-rays about 12 or 13 days ago, and x-rays are normal, everything's where they should be, but the imaging center did not get my discs sent. So I had to push back and still haven't technically had my first post-op appointment. However, after emailing Rasouli a couple times, he reached out to me via phone call, which I really enjoyed that. And he kind of was just answering any questions I had, since I felt like I was in some sort of limbo by not being able to have my first post-op appointment, and that might even be still later in the week, next week, or even the following week, depending on when they get my images. And he had a lot of positive things to say that made me feel really good. As a week 3, I felt like I was kind of in a standstill, and I knew at that time I was probably going to get less limitations and less restrictions as far as what I could do. So I was a little frustrated that week. But a few things he told me. He said I don't have to really wear my brace anymore. He said that's more of a comfort thing and a peace of mind. Isn't necessarily helping me or not helping me structurally. Again, just for comfort. Other words, optional. So I haven't been wearing my brace now for about a week. I started kind of weaning off a couple days before I had that conversation, as that's kind of what I expected at 3-week post-op appointment anyway. So I was kind of correct in doing that. I've also been using 5-pound weights for like really basic seated exercises. He said I can, at this point, kind of listen to my body. Of course, still no bending or twisting. But if I want to use 10 or 15-pound dumbbells to do certain exercises while maintaining a neutral spine, he said, listen to your body. So definitely some freedom there. He also cleared me to use the recumbent bike after 4 weeks. So that will be June 5th. I will start using the recumbent bike to build my cardiovascular fitness again, which I'm really looking forward to. I never used the recumbent bike, but I've never been so excited to jump on that thing. I actually have one, or at least I got one from my mom, so I will be using that and excited to do so. I still have not heard back from billing, as far as I was told that my deductible, which was like really nice, it was like $2,300 or $2,800, and they told me that was the most I would pay out of pocket. However, insurance still may cover some of that, so I still not have, and that's Blue Cross Blue Shield, Florida Blue actually. I haven't heard either way if what I owe on that, so kind of crossing my fingers. Guess no news is good news at this point. The only negative thing I can say is I developed a stitch abscess right at the bottom of my incision. My incision looks great. I was a little spooked there for a moment. I had like a staph infection. I went ahead just for peace of mind. I saw my PCP yesterday and they did a culture on it. But I think most relatively, I spoke to a coworker of mine. who is or was a surgical PA for like 9 years and in plastic surgery. So she saw these incisions similar to mine like all the time. And I sent her a picture. She's like, yeah, that's a stitch abscess. So I'm going to go ahead and assume when I get those culture results back on Monday, I don't have a staph infection. It seems to be getting better. And it seems to really line up with everything she said about using her expert insight to recommend that it's probably a stitch abscess, just topical antibiotics, and then the stitch will become kind of visible. It's kind of being pushed out, and then I'll just need to like clean it and then remove it. So that's really the only negative thing, just a kind of a quick pain update. I did quite a bit yesterday, so I'm a little sore. I was a little sore this morning. The weather's kind of been funking up and down too, so everything's kind of sore today, like ankles, knees, hips, and then lower back. It's all kind of consistent, like 2 or 3 out of 10, just kind of achy. So still feeling really good. So happy to answer any questions that you guys might have.